This is the Little Moments Count radio podcast, created in partnership with community radio stations throughout Minnesota. Each episode, you'll hear interviews with early childhood experts on how to support the important brain development that takes place in the first 1,000 days of life, just through little moments every day. Learn more at littlemomentscount.org/podcast.
Good day to be Indigenous.
Get up, stand up.
They are going to become more brutal.
Couldn't cut, hitting cut again.
Because all the hippies were trying to be Indians anyway.
They're going to become more repressive because it's a matter of dollars and their illusionary concepts of power.
Hey, Victor.
We must live in balance with the earth.
And also with recent happenings at Wounded Knee.
I am awake.
Welcome to Native Roots Radio Presents I'm Awake, and I'm your host, Wakanja Hade. Hey, Karagi to all my friends and relatives in four directions. You are listening to Native Roots Radio Presents I'm Awake, and I'm your host, Robert Pilot. Hey, we discuss local, national, Native news and events, and as you know, Native issues are human issues, and human issues are Native issues. So, yeah, we're going to have Heather come on, and Heather is, again, a dedicated clinical pharmacist with mHealth of Fairview and a proud member of the Mohawk community, and is passionate about transforming health care through holistic, inclusive practices. And she works at clinics and blends food, supplements, and prescriptions to empower patients on their health journey. Beyond her clinical work, Heather leads Native health equity initiatives at mHealth Fairview, advocating for strong partnerships with Native communities and creating inclusive spaces. She co-leads the Indigenous Healing Circle Employee Resource Group. Wow, that sounds really cool. Fostering connections and healing for Native employees and allies. I don't really have to talk to her about that. As a mentor to Indigenous and minority students, she champions the next generation of healthcare professionals. And Heather's also serves as acting secretary of board directors for the Indian Health Board Clinic in Minneapolis, continuing her mission to improve health equity for the Indigenous population. And that's pretty awesome. It's really cool to have you on again. So how are the kids? Are they out doing hockey yet, or you got to take them there pretty soon?
Oh, we have hockey in a little more than an hour. So I told them they're not allowed to come upstairs. They have to be quiet. Don't come and find me unless something's broken or bleeding.
Yeah. Well, what's interesting too is last time you were on, you were here, and thank goodness you're not here because both Wendy and I have a cold, and so we don't get to see the grandbabies.
Yeah.
Yeah, something's going around, right?
Yeah, for sure.
Well, let's get right into it here. You know, and again, I've read your bio, and I think you've mentioned this too before. Then when you were on our show in the past about. You have like a healing circle for employees.
Yeah, so I help to lead our Indigenous Healing Circle employee resource group. And Fairview has a handful of different employee resource groups. And this one really exists to bring together and connect Native employees across our system, since it is such a big system. And a lot of times we might be the only Native person in our workspaces or in our departments. So we wanted to create this space where our Native employees and allies can connect and just know that each other are there. And then we also really help to support the Native health equity work that we're doing in our system. And because this is really like an employee group, we're also looking at how do we educate our non-Native colleagues on issues that are unique to our community.
Yeah, when I was talking earlier, I just think that our allies and most people do not understand what sovereignty means, and it's not taught. And They think it's a prehistoric name. Hey, can you briefly share the role in mHealth Fairview's Birth Justice Initiative, and what is birth justice?
Sure. So the Birth Justice Initiative is a cross-cultural or cross-departmental effort that partners community and patients, providers, and employees to basically align and amplify equity-driven solutions across our system and in our communities, with the goal of improving outcomes for birthing individuals and their babies. And birth justice, I think, it's really multifactorial. In my opinion, right, it means that everybody has the opportunity for beautiful, culturally rooted birthing environments and spaces. But it also means that everybody has an equitable opportunity for prenatal and postnatal care that's free from judgment, racism, and bias, essentially to produce healthy babies, healthy parents, and healthy families.
Yeah, that's awesome. And I want to get into more questions here in a little bit. We got only like a minute left here, and I appreciate you jumping back on here. But I also want to read this before we break. And I say this episode of Native Roots Radio is presented in partnership with Little Moments Count and Minnesota Public Radio. Little Moments Count is a statewide collaboration focused on helping parents and caregivers learn about the importance of brain development in the first 3 years. And boy, we're seeing that with our little grandchildren, and their brain development every week. It's crazy. This is
so fun to see that.
It's a fun time, and rumor has it it's one of your favorite times for you with kids, right? When they're this young.
I do really like the 15 to 18 month range. They're adorable. They're mobile. They're starting to say some things, but they haven't quite learned no yet. So that's what I like about it.
Oh, the daughter is going to be, or the granddaughter is going to be the first one to say no. I do believe I can just when she gets dropped off, she side eyes us. So she started already, and I think she takes after the mom and the aunt a little bit. Yeah. Hey, we're here with Heather Fahey, PharmMD, and we're doing our Little Moments Count segment, and we're going to be right back. This is Native Roots Radio.
Do you know that from birth to age 3, simple activities like talking, playing, reading, storytelling, and singing can boost your child's development? Little Moments Count provides parents and caregivers with the resources they need to make the most of your time together. Visit littlemomentscount.org for resources designed to support you in giving your child the best start in life. Again, please visit littlemomentscount.org.
Welcome back to Native Roots Radio Presents I'm Awake, and this is Robert Pilot. Hey, Native Roots Radio is excited to be partnering with Little Moments Count to host conversations focused on early childhood and development. We'll be guests every week and talk about other developments, and we are really excited. For more information, you can visit littlemomentscount.org, and I have our friend Heather Fahey, who's a dedicated clinician pharmacist with mHealth Fairview and a proud member of the Mohawk community. And you're passionate in transforming healthcare through holistic, inclusive practices. And I'm really just great to have you on again. And we're both kind of sick, so hopefully we can hold on to the audience.
Yeah, exactly. I had a patient today ask me if I was okay, and I'm like, I probably sound worse than I feel, but still never fun.
Oh, I know. I got to ask you a couple questions here, and one of them is going back into how was the history of healthcare for Native people shaped birth and pregnancies experience today? So how is it the history? And we know it's a dark history.
Yeah, it is a dark history. And the reality is that, women and children have been targeted for genocide, for elimination as part of the U.S. Indian policy for a long time. we know that children were taken from their homes in the boarding school era. We know that during that time and for quite a long time after, that women and girls were sterilized without their permission and without their knowledge as a way to, again, eliminate us. If they were sterilized, they weren't going to be having any more Native babies. And so there's a lot of trust issues within our health systems and between our communities, particularly our Native communities, but a lot of communities of color as a result of the history. And so I think this is part of, it's most certainly part of what has led to the health disparities that we see in our community, and really high rates of basically, death in mothers and babies, or just kind of overall poor health outcomes in mothers and babies. So yeah, not a great history, and it's led to a lot of issues today.
So I know it's really interesting, and we've talked about this before with my wife, Wendy, where she's connected with our Native community when she was a pharmacist, and by asking questions and the correct questions, and then saying that my husband's an enrolled member of Ho-Chunk Nation and knocking walls down, what are the biggest trust gaps that you're working to heal with?
I think the short answer is just trust in general. So first and foremost, just acknowledging that there is such a big gap in trust and sharing the true history of what has happened in our communities, making that knowledge widespread among our colleagues and the providers that are caring for these women and caring for these babies, and birthing parents in general. So I think in efforts to build some of that trust, we're trying to make sure that we are listening to the community. What is the community telling us? We are not the ones at Fairview saying, here's how we solve this problem. We're saying we acknowledge that this is the history, and, trying to co-create some of these ways to build back that trust.
Yeah. Well, and part of it too is having people that look like them, like yourself, and that's, we'll talk a little bit again when I mentioned with Wendy, but, why is representation so important, and why is it important for pregnant moms and parents to be able to see themselves in the care team?
Yeah. I think about that example that you've shared, Wendy's experience in clinic, and even though Wendy herself is not Native, she's very in touch and in tune with what's going on in the community. Mm-hmm. And I think that when you make that connection with somebody, there is just kind of this inherent level of shared experience and shared understanding that can start that relationship, where, if there's not that connection of a little bit of understanding of, who I am and how I got here and why I'm here, I think a lot of barriers, defense mechanisms get put up. And, when I think about so I have 3 kids, and when you are giving birth, that has got to be the most vulnerable time, or one of the most vulnerable times in a parent's life. You are going through what is an extremely natural, probably the most natural experience of life, and especially as a mother. But there's so many things that feel out of your control that you have to be able to trust the people that are around you to make sure that you can, come out, first of all, alive, and with, be able to bring your baby home, and, just to start off on the right foot and bringing your baby into the world in a good way.
Wow. And, as you were speaking about your work and your, activism for our culture, I just was thinking back 20, 30, 40 years ago, not that long ago, where this was not the case.
Mm-hmm. Yeah, no. And I think I keep hearing over and over again how this is not a new fight. We've been, the community itself has been having these conversations for decades. So, I think that it's almost unfortunate that okay, are we still having some of these same conversations? But we are. And I think, I'm trying to even understand my own role of, okay, I'm in this position now. So how can I do what's in my power, to try to make a difference?
Yeah, and it's interesting too. We talk about this a lot in the Twin Cities. Minneapolis has, the largest urban native clientele in 111 different tribes and 75,000 people just in Minneapolis. And so, with this next question, it's kind of a difficult one to pin down. But I'm wondering, what native birth traditions can you support in the hospital, and how's your team making spaces for these practices? Because there's not a pan Indian kind of way to do a lot of things, but then yet there is similarities.
Yeah. I mean, I think, first of all, we acknowledge that it is quite literally the law for Native patients to be able to practice their spiritual practices. And so we have created some policies across our system, specifically with regards to smudging, that smudging is allowed. Quote unquote allowed. It's allowed by the law, but it's also something that we created a policy more as like a guide or framework for even all of our employees to understand that this is something that we can do in the hospital. Because I think, smudging specifically, I like to kind of joke about if you're a nurse on the floor or a pharmacist on the floor or a physician and you don't know what smudging is and a patient requests to light something on fire in their room, you're going to be like, absolutely not. Right. But the policy exists so that we can increase education around what it is. And then basically just to have in writing that this is allowed and we need to accommodate when patients request something like that.
Wow, that's amazing. Not getting too deep in the woods, but I know the Pan way is people smudge with sage, but different nations, including Ho-Chunk, for instance, it's flat cedar is what we smudge with, and different tribes smudge with different medicines.
Yeah. Well, and that's another thing that we've included in our education is that, this is if you're a provider on the floor and a patient asks to do this, you take the patient's lead, we want the patient knows best, essentially, right? There's not a right or wrong way to do it. And it is not for us to say it's only, this policy only allows for sage or this policy only allows for cedar. That's not the case.
Right.
The policy is that smudging of sacred medicines is allowed and the patient knows best.
Well, one of the things for our listeners who may not know, can you tell people what a doula is and how doulas help for safer births? Boy, I cannot talk today, and I have a talk show. Oh,
I think that a doula would probably be the best person to answer that question. But basically, my understanding, both through my professional experience and my personal experience, I actually had a NINDA, an Indigenous doula, for my third birth. And so they're really just a support person and an advocate for the patient. And and someone that we are trying to ensure is a legit member of the care team. But there's somebody who knows the birthing parent, who hopefully, especially if there's, cultural requests, that the doula is able to help, again, advocate, and help to manage those types of, whether that's ceremony or other things. But really, a doula is, part of the care team, really just helping to make, advocate for the patient. And actually, again, I'm not a doula and I'm not a researcher, but there is research out there showing that when you have a birth with a doula, there's often better outcomes.
Excellent. Hey, Heather, we're with Heather Fahey, PharmD, and can I call you Dr. Heather?
Sure.
All right, we'll be right back with Dr. Heather Fahey. This is Native Roots Radio. And we're back to Native Roots Radio presents I'm Awake, and this is Robert Pilot. Hey, welcome back, everyone. And I just want to read this out here. Native Roots Radio is always excited to be partnering with Little Moments Count, a statewide collaboration focused on helping parents and caregivers learn about the importance of brain development the first 3 years of life. And, isn't that important? We always have, and we're here with Heather Fahey, Dr. Fahey, and we always try to sing to our grandchildren and talk to them and keep their minds going. I'd like a beat down there and trying to teach them drumming, and if they do 3 beats and things like that, just to keep the mind going. But those first 3 years are unbelievably important. And welcome back, Heather.
Yeah, thank you. Happy to be here.
Wendy says hi, by the way. She's listening to the show in the other room.
Hi, Wendy.
Yeah. So it's just amazing. I got a few more questions here, and I know you got to get going because you're not only a hockey mom, you skate with the kids. And I guess Wendy and I still can't get over that. We've talked about that a couple times since you were on last.
I do. I skate with all 3 of them, and I might be crazy, but I also figure I'm there anyways. And I grew up playing hockey and played all the way through college. So, yeah, I don't know. I think it's good for my boys to have a strong mom on the ice with them.
That is awesome. And just not to go again deep south here, but I went to school with Joe Mauer's mom, and she was their baseball coach. All the brothers and sons, and she was a heck of an athlete in high school, period. So that power to you. That's awesome to hear.
Yeah, thank you. I like to joke with the boys because, they're 10 and sometimes they get a little bit too big for their, skates. And I just tell them all right, guys, when you play Division I hockey, then you can tell me that you're better than I am.
So did you play hockey in college?
I did, yeah.
What? I did not know that. What? Yeah. That's crazy. Division I?
Mm-hmm.
What? I'll have to text you after the show here because we have a few other questions to and then we'll have to have you on the show again. Jeez, that's amazing. I didn't know that. You're humble. I'm proud of my humility. I talk about it all the time, but you're really humble. Hey, so last week your team led the Birth Justice Summit. Can you tell us some insights of what you learned from this event? And it sounds like a powerful event.
Yeah, it was a really powerful event. We hosted it at the University of Minnesota at the Masonic Children's Hospital. And what it was is we actually had the women's drum group from Division of Indian Work come and open us up, and we smudged in the space. And it was open to providers across our system. So, physicians, nurses, anybody working in labor and delivery, and then also to community doulas. So it was really just like a way to bring together our frontline workers and community doulas, just to create more communication and open dialogue, and really also just to develop relationship. But it was a really powerful event. We had Dr. Katie Casamano from the U come and really frame up the history that we kind of alluded to earlier, about how our women and children have been targeted, and then how that has led to the significant disparities that the community faces today. And she had a really incredible way of, like putting life behind the statistics. There was a lot of numbers provided, but I was joking with her, and I said this at the conference, that I've never had such an emotional reaction to a statistics lecture before. It was just so powerful how she really is able to remind us that, like, even with all of these numbers that she's talking about, is the life of a mother, is the life of a baby, which impacts the family and the community for generations. So she provided some really tough information that was probably news to some people in the room and not news to others. And then we had a panel of Ninde doulas from Division of Indian Work share their real life experience of being a doula for birthing parents, and all of the different complexities and difficulties and great joys that comes from doing that. So it was a really cool way to see, like, here's the statistics about the community, and then this is what that actually looks like in real life. So wow. It was a really, really cool, like, emotional, I would say, event.
Wow. That does sound emotional and very needed. What are some of the changes that are happening on labor and delivery floors to create cultural, safe, welcoming spaces for families? And I guess, part of that answer is that just to give knowledge to the people working there, right?
Yeah, absolutely. It's education. Like I said, education of our non-Native colleagues about these Native issues and Native history and what has led to the disparities in the community. But I think it's also acknowledging the history and spreading awareness about that, but then also moving forward of we talked about having a smudging policy. So letting everybody know, again, whether you're Native or not Native, that this is something that's allowed in the hospital, incorporation of culturally rooted practices. I also think we've been working on, again, kind of that incorporation of the doula as a care team member. So there's been some updated internal processes and policy on making sure, how many people can be present at the birth, or even present in the operating room if that's a necessary step. Trying to update language to try to eliminate bias in the whole process. And then really just again, listening to community and working to identify some of the immediate action that we can take. And then just strengthening that communication between the doula community and our system, which over the last year, we've been having monthly meetings with community doulas so that we can more readily identify, are there not so great experiences that you've had and how can we fix that? And then are there good experiences that you've had that we can build upon?
Hey, in the last 30 seconds for parents listening right now, what are 3 simple steps planned for a safer, more culturally respected birth?
I think the first thing I would say is as soon as you find out you're pregnant, schedule a prenatal visit. I think that the sooner you can get in for a prenatal visit, the sooner we can address any, and hopefully prevent any, speaking of babies born, this is my baby. Yeah. So the sooner you can get in for a prenatal visit, we can hopefully prevent any issues down the road. I would encourage, finding a doula, because I think that they can be just a great advocate. And then just make sure you have a provider that you really like, and know that you have every right to, change providers, or, if your first visit didn't go so great, it's all in your rights to find somebody that you like.
Wow. Heather, thank you so much. And now I got to Google your name and see what college you played for. Hey, this is Native Roots Radio, and we were with our friend Heather Fahey, PharmD, and working with Little Moments Count. We'll see you tomorrow. This is Native Roots Radio.
Thanks for listening to the Little Moments Count radio podcast in partnership with community radio stations throughout Minnesota. You can find the Little Moments Count radio podcast wherever you get your podcasts and at littlemomentscount.org/podcast.